Hello, and welcome to One World, One Health, where we take a look at some of the biggest problems facing our world. I'm Maggie Fox. This podcast is brought to you by the One Health Trust, with bite-sized insights into ways to help address challenges such as pollution, climate change, and infectious diseases. A One Health approach recognizes that we're all in this together and that everything on this planet, the animals, plants and people, and the climate and environment are linked. Where you live matters. People have known about good neighborhoods and bad neighborhoods since there were neighborhoods. We also now know that in the U.S., zip codes are tied to health. You can predict health and even how long someone will live simply by looking at their postal delivery code. What people still need to learn more about is why. It's painstaking work to break it down, but a team at the University of Texas at Austin has taken a close look at one important factor: air pollution. They found that several important types of air pollution are worse in areas with higher percentages of Black and Latino residents. Understanding this can give policymakers the information they need to make important decisions. In this episode, we're chatting with Sarah Chambliss, who led the study. She's a research associate in the Department of Population Health at the Dell Medical School at the University of Texas at Austin. Sarah, thank you so much for joining us.
Oh, it's my pleasure.
You've broken down people's exposure to air pollution by neighborhood. What did you find?
Well, we found, surprisingly, that within the city of Austin, there are some neighborhoods that are consistently more polluted over the course of the year than other neighborhoods. And we also found that depending on the kind of pollution that you're looking at, whether it's coarse particles or fine particles or sulfur-based gas particles, we found that some neighborhoods were high in levels of some of those and some in levels of others, but pretty consistently, the share of residents of the neighborhood who are either Black or Latinx was associated with higher level of many of these types of pollution.
Why do you say you find this surprising?
Well, I think that Austin is typically considered to be a city with pretty clean air. It's not really like Houston, where people think it's a big industrial center. And I don't think that we in Austin think about our air pollution being that bad. And also, in general, when people think about air quality, they'll often think, well, I live in a city, so it's polluted, or I live in a rural area, so it's cleaner. But people don't necessarily think that if you drive 2 miles from one neighborhood to another, you're driving from an area where health is much more strongly affected by the air than in the other neighborhood.
Can you tell us just a little bit about this particular air pollution? What kind of, if you say Austin's not an industrial city, and it's not, where's this pollution coming from?
Sure. Well, we do have a couple of power plants. They're natural gas, so not quite as dirty as coal-fired power plants. We have quite a bit of traffic that comes down I-35 in the middle of the city. I'd say traffic is a big contributor to our urban pollution. And then there are other distributed sources. There is some manufacturing in town. Landfills also contribute to local pollution. So little things add up.
So air doesn't stay in just one place. So how does pollution in one area end up affecting another area? Or are these neighborhoods backed up to the sources?
Yeah, I'd say that neighborhoods that are right next to major freeways, the major highways, are getting the full blast of pollution from exhaust. And as you get farther away from a highway, it gets more diluted. So air definitely mixes, but right next to the sources, you're getting the full brunt of the plume.
Does the geography of Austin affect this in any way?
Well, there's a lot of interesting dimensions to that. So the basic geography, there's kind of a flat area where most of the city started. And then if you go west, there's hill country. But also the hill country tends to be more affluent in addition to being less suitable for large industry to develop. And then the east side of Austin is a historically redlined area. So the geography is influenced in a large degree by historically discriminatory housing practices. So there are both historical levels and geographic levels to how neighborhoods have developed in Austin.
Redline, that's a term some people understand, but can you explain that term a little bit?
Well, this is a little bit beyond my own area of expertise, but it's part of a larger issue where people of color were systematically denied housing loans and also denied access to housing in neighborhoods, or loans weren't given in neighborhoods where there were people of color. There were also covenants, like neighborhood covenants that also restricted, that were basically pushing segregation. So redlining is a little bit of a shortcut phrase for areas where segregation practices were the most pronounced.
People were literally drawn out of certain neighborhoods.
Right. Just not, there were all kinds of systems in place that denied them the ability to live in, and also redlining coincided both with the places where people of color were allowed to live and also the places where industry was allowed to develop.
And that leads to my next question, which is anyone really surprised to find that people of color are more likely to live in these areas that are more affected? Our society and culture has pushed minorities into less desirable areas.
Right. Well, is anyone surprised is an interesting question. I think that there are people who just don't think about it. There are probably people who would be surprised to hear this, even though if they, were more in touch with environmental justice news, they wouldn't be surprised. I think one of the things that people are very aware of is that the concentrations of pollutions in some of these neighborhoods that are identified as neighborhoods where there's several levels of social vulnerability that are higher, people are aware that in these high social vulnerability neighborhoods, there are higher concentrations of pollution. But what the data very rarely show yet, because people aren't looking at it in this way, is that people are going to the hospital for asthma, for example, more in these neighborhoods. We know that the risks are higher, but going to the data from health records and showing that these risks are borne out in the health data, which you need to do an amount of statistical analysis in order to isolate that signal from a lot of other signals. I think that is what is more novel and revealing, that we actually see quantifiable, identifiable, higher health burden associated with the pollution levels.
Can we talk a little bit more about that health burden? People are showing up in the ERs. What's happening there?
Sure. So this is for people who suffer from asthma. We looked at anybody who goes to the ER for asthma, and it includes children and adults. As background, in Texas, the rates of asthma among Black children are much higher than the rates of asthma among white children. And both Black children with asthma and Latinx children with asthma tend to go to the ER for it at twice the rate of their white counterparts. So it's both that they develop asthma more and also that the amount of asthma care that they receive isn't controlling it as well.
Is that what it is? That it's uncontrolled asthma? Is this a lack of access to health care?
That's a good point. And this is one of the things we controlled for. We looked at neighborhood uninsured rate alongside pollution and alongside the share of households living under the poverty level. So we also have some individual level data that our lab has been looking at that looks at the level of medication that a child is receiving when they receive their diagnosis. And so it's a very intertangled up issue. The access to healthcare and also both being able to get treatment and get a diagnosis, those are things that contribute to higher rates of ER visits. But we did our best to account for that. And just simply being exposed to worse air pollution is something that can trigger asthma, trigger an exacerbation that requires an emergency room visit. Even if the child has been diagnosed, it's a known issue. Actually, we're talking about children and adults, and they have medication. Higher air pollution can just be one more, I was going to say it's kind of the straw that breaks the camel's back for some people.
It's one more factor. All this stuff is piling up.
Yeah.
So how did you go about measuring this?
So we have, for the medical records in the state of Texas, they collect information centrally from every hospital. And it's called the Texas Healthcare Information Collection. And you have to do a bunch of administrative work in order to get access to it because it's protected data, it's private data. So we arranged to be able to use that data. And then there's a lot of publicly available data on air pollution. And we used one particular set from the Center for Air, Climate, and Energy Solutions. But we're actually right now comparing the results that we got from those set of pollutants with another set of pollutants. But yeah, publicly available air pollution data, and then somewhat of a pain to get access to healthcare data.
So how can you use your findings? Will you advocate for change? Can someone else take your findings and use it to advocate for change?
Well, I don't make policies. Sometimes I talk to policymakers. I think that different audiences respond differently to different kinds of information. There are, at the legislative level, some sort of cold hard calculations that go on where they say, well, it's going to cost this amount of money. It's going to hurt the economy this amount to control air pollution. And so how can we justify that economic hit? And when you say, well, think about how much it costs for missed work days, for healthcare, emergency healthcare for an asthma exacerbation, for the medication required, when you think of, in addition to emotionally how difficult it is to deal with your child not being able to breathe, you're also able to put these financial numbers to say air pollution is costing citizens of Texas a lot of money because of the health impacts that it's having. It's kind of like the cold calculating way of thinking about it. And then I think it also helps people in these neighborhoods feel more urgency in advocating for clean air, letting them know that when they support efforts and opportunities to get a big polluter out of their neighborhood, they're going to see health benefits for themselves, or for their families, or for their neighbors.
It really can be a pragmatic calculation, can't it? Because it costs a lot more to show up at the ER than it does to just prevent a problem in the first place.
Yeah, like I said, I'm not a policymaker and I'm not involved in sitting down and writing out these calculations. But I think that oftentimes the way that change happens in reducing air pollution is putting up all of these healthcare costs against the cost of controlling air pollution and realizing that releasing something into the air, even though it's convenient and helps you get your product made, is having such a detrimental effect on society that you really are costing people a lot by doing it.
Does it say anything that you found these great disparities in a city like Austin, which, as you say, tends to not have a lot of industry, where you don't have a lot of heavy-duty industry right in neighborhoods? It's a place where there is good health care available. What might be going on in places that are a little less open to this kind of intervention?
Yeah, that is a really excellent point, that the amount of local interest in preventing overdevelopment of highly polluting industries is a lot higher within Austin city limits than it is in a lot of other communities. And I think this is a neglected area of inquiry, that being in a place that doesn't have local limits, you're at the mercy of what the state lawmakers want to make. And if they're not really aware of how bad things are in your neighborhood, they don't have a connection. They don't have a reason to say, oh yeah, this factory that's going to bring in millions of dollars to the state economy is not worth it. And people who live in those neighborhoods don't have a place to go to complain or to advocate that these sources not be there. Or if the sources are already there and they're ratcheting up, that's another thing that happens. Like a source will be placed somewhere with a certain level that they agree, this is the limit of the pollution here. And then they'll keep applying to be able to pollute it more and more. I think that this is adjacent to what I do, but it's something that we see as we're looking at this problem from a healthcare perspective and from more of a public health perspective. One thing that's really interesting that we're looking forward to see is that EPA has now put in place this more stringent limit on PM 2.5 that's taken it down from 12 to 9, which puts certain neighborhoods in Austin in non-compliance. And it puts a lot of areas in a lot of cities that had been considered clean now. It's forcing local and state actors to make plans to reduce the pollution. And one thing that isn't usually supported by Clean Air Act type policies is saying we're going to go into neighborhoods with a higher burden of sociodemographic factors that lead to worse access to healthcare, and try and think of opportunities to improve pollution in those neighborhoods.
So what you're saying is federal policy can make a difference. These new Environmental Protection Agency guidelines or rules can have a local effect.
Right. There needs to be some motivation to act. when you're balancing economic growth against public health, if you don't have some sort of mandate to protect public health, it doesn't end up being the priority.
Sarah, thank you so much for joining us and explaining all this to us.
Yeah, absolutely. I'm glad to have the conversation.
Listeners, if you enjoyed this podcast, please share it. You can learn more about this podcast and other important topics at onehealthtrust.org. And let us know what else you'd like to hear about at owh@onehealthtrust.org. Thanks for joining us.
Thank you for listening to One World, One Health, brought to you by the One Health Trust. I'm Ramanan Lakshminarayan, founder and president of the One Health Trust. You can subscribe to One World, One Health on Spotify, Apple Podcasts, or wherever you listen to podcasts. Follow us on social media at One Health Trust, one word, for updates on One World, One Health and the latest in research on One Health issues like drug resistance, disease spillovers, and the social determinants of health. Finally, please do consider donating to the One Health Trust to support this podcast and other initiatives and research that help us promote health and well-being worldwide. Until next time.